Now, should the government be telling companies how to do their business? Let's bring in Erica Payne, Senior Advisor, Roosevelt Institute, and Michael Cannon, Cato's Director of Health Policy Studies. Michael Cannon, one of the things that always strikes me as curious is poll after poll shows that nearly 80% believe that their health insurance is good or excellent. And here is the White House with a full-scale assault, as John Harwood said, painting a bullseye on their foreheads. How do you assess that? How is this possible? What the heck is the disconnect here?
Well, if the government knew anything about running a health insurance company, then Medicare would be turning a profit instead of running an $80 trillion deficit. And if the president wants to haul some people around a conference table and berate them for high premiums, he should be hauling Mitt Romney and Deval Patrick, governors of Massachusetts, around that conference table, because it's in Massachusetts where health insurance premiums are rising the fastest. And that's precisely because Massachusetts has already enacted the Obama health plan.
Erica, my concern about getting the government involved in healthcare is that I was talking to a doctor the other day who said he likes to have Medicare patients. He tries to focus on them because he gets paid 3 times as much from the government as he does as what he's contracted with insurance, health insurance companies. If they're running the whole thing, it seems like it's going to get more expensive, no?
Well, I think it's really a question of values. Do you want somebody sitting on their hospital bed arguing with their insurance company over whether or not they should get a treatment? You know, does somebody who works for a living, should they have to have an insurance, a low-level insurance employee arguing with them?
Charging, paying a whole bunch. What does that have to do with Medicare paying doctors a lot?
If you look at Medicare as a whole, it is the most efficient medical delivery system that we have in this country. And if you look at the health system as a whole, in contrast, it's the least efficient, the most expensive, and we're still 37th in the world. We're the richest country in the world, and we're 37th in the world.
Erica, I'm not going to deny that Medicare provides valuable services. But when you say it's the most efficient, it's 30 trillion some odd in the whole. Why is that? What does that tell us? How does that inform us?
Well, Medicare is sponsored by the government, and as such, it has an obligation to cover people. Its obligation is not to make a profit. Its obligation is to provide health care.
Break even?
Whereas health insurance companies have an obligation to develop.
Break even.
The Medicare system is a very efficient health care delivery system. Look at any report from any economist. It is an efficient delivery of the services that it provides.
Mike Cannon, let me just go on to this. In this health care bill, there's going to be massive regulation of insurance companies, and they're going to face higher taxes. Just want to get you to comment. Yes, there's a universal mandate, but regarding insurance companies, they're going to order the benefits, they're going to dictate the benefits, they're going to regulate the prices, they're going to regulate the doctor and various services reimbursement rates, they're going to set up a bunch of boards. Essentially, it will become a government-run insurance industry, will it not?
It'll essentially be socialized through the private sector, and it's completely disingenuous for the president or other supporters of the Democrats' health legislation to say that they don't want private insurance companies coming between patients and their doctors. The Price Control Commission that the president has announced or proposed, it would tell insurance companies, no, you can't raise your premiums by 10%. You can only raise them by 5%. So when insurance companies can't cover their costs, they're going to start denying services. And the cause is going to be that government price control commission. It's a tool for enabling the government to implicitly ration care without getting their hands dirty in any of those actual medical decisions.
So you have a choice in front of you. I mean,
they'll turn around and blame that on the insurance companies rather than on the regulations that actually cause the problem.
One of the insurance companies that's in the news right now is WellPoint, and they asked last year in Michigan for a 50% increase in premiums. So a normal individual who is paying maybe $8,000 a year is going to see their health care costs go up by $4,000.
You can pick out a high premium increase like that any year, any day of the year.
That's exactly right, and that's part of the problem. You can't pick out a rate increase like that any day of the year.
What you want to do is compare average premium increases state by state, and Massachusetts has the highest average premium increases for any state in the union, and that has already enacted. Massachusetts has already enacted the Obama health plan.
But premiums are going to rise. Erica, how do you respond to the argument, though, his original argument that if they don't raise premiums, the other option is they're just going to deny services? How do you respond to that argument? Because that seems like a pretty, I mean, that is kind of the experience that you have. If they don't raise your premium, you end up getting less coverage. It's not great, but that does seem to be the trade-off. How do you respond to that?
I think everything that you're saying is exactly right. They are denying coverage. They're raising premiums. They're denying coverage. And 45,000 people died last year because they didn't have the right kind of health insurance.
Well,
And again, it comes down to this question of values. Do you think that people who have worked their whole life for a living deserve to be sitting in a hospital bed and arguing with their insurance company?
Larry and Trish, may I add one thing?
I just want to raise this point.
The left likes.
Go ahead.
The left likes to talk. The left likes to talk about this bogus number of 45,000 people dying because they lack health insurance. The Institute of Medicine says that 50 to 100,000 patients die every year because of medical errors. The #1 contributor to medical errors in the country is the Medicare program that Erica thinks is so efficient.
So what's the answer? I mean, what is the answer? There are a lot of people out there who are watching this and saying, my insurance premiums have gone up. My coverage has gone down. I don't like the government plan either.
Mandates.
How do we get, I mean, isn't the answer overall that we need to somehow get costs down, costs back in line? How do we do that?
One size fits all doesn't work. These governments, Erica, you are right about Michigan. Guess what? They mandate everything. They tell these insurance companies that you have to have these full Cadillac insurance policies. There is no bloody choice in this system because all these state governments are meddling. And what Obamacare is going to do is make the state government meddling nationwide. Do you understand? There's no real choice. That's why the costs continue to rise. If you put choice into the system, Erica, you'll have a much more efficient, real free market competition.
Right now, 99% of the markets in this country are essentially monopolies. And so the people who are making the decisions for 99%.
And don't you see, Eric, I agree with you on that point. And here's where I'm going with you. I want interstate competition for insurance, and I want the government to get out of mandating insurance policies. That's what I'm saying.
There's no doubt.
Make it real competition.
Wait,
I agree with you.
I can't believe we're all agreeing. Michael, do you agree with this? We're going to all agree, and then we're going to go to a
we all agree that more competition can potentially be a great thing. The question is, how are you going to get to more competition?
Michael, go ahead.
The main problem with America's healthcare sector is that the wrong people control the money. The government controls half of the money. They delegate another quarter of the money, that control over that quarter, to employers. And so consumers don't have any incentive to economize because the savings don't go to them. They go to an employer or they go to the government. We need to let consumers control their own healthcare dollars, and they will wring inefficiency out of the system.
That's it. We all agree. Thanks to both of you for joining us. I think